All right, so we got Porky the Pig. That's a great closer. I was trying to think of I keep asking I think, two easy trivia questions. Again, I don't have any more food or anything to give away. Just the pride of knowing you get it right. Green eggs and ham. There's only one polysyllabic word in green eggs and ham. So while you guys start thinking about this, does anyone know this? Okay, good. I thought I saw you got this? What? Yes. Anywhere. So I will not eat them here or there. I will not eat them anywhere. Wow, that's the second one you've gotten right. You have a 1-year-old. That's pretty amazing. I'll have to think of something else for the next group. Okay, so I want to introduce Dr. Maryam Mahmood, who's been going over some cases, interesting cases, sort of neuro ID. Went to medical school in the University of Auckland in New Zealand, did internal medicine residency at Reading Hospital in Reading, Pennsylvania, and an ID fellowship at Mayo Clinic, and joined our faculty a year ago, less, something like that. I'm not going to, in days. A lot of focus on nuclear imaging in cardiovascular infections, but very interested in this as well. So a fun fact about herself is that she loves to travel and has been to every continent except Antarctica. So please welcome Dr. Mahmood.
Thank you. So I'll be presenting some interesting and interactive cases, so get your little clickers ready. Our first case is that of a 24-year-old man who has a history of injection drug use and is brought into the emergency room with acute confusion and agitation. He's febrile to 38.7 and hypotensive, requiring pressor support. His initial labs are notable for a neutrophilic leukocytosis of 19. He has a negative HIV screen and an unremarkable CT head. And his urine toxicology is positive for cocaine and amphetamines. He undergoes a lumbar puncture and has a nucleated cell count of 79 with 61% neutrophils in his CSF, red blood cells of 52, low glucose of 39, and significantly elevated protein of greater than 1250. The gram stain is negative and bacterial cultures from CSF are pending. So he's admitted to the ICU and started on vancomycin and cefepime empirically. And about 14 hours later, his blood cultures grow MSSA, and antibiotic therapy is narrowed to nafcillin. At this point, ID is consulted for additional recommendations. So do you, A, say that the CSF analysis looks consistent with partially treated meningitis, and we should continue therapy with nafcillin?